So over the past few days, two stories have hit the news like a freight train. Both involve sisters in labor, having babies, and being treated pretty much less than human by the workers at these hospitals, these places that where people are hired, where they are required and promised to take care of people and treat them like people and give them the best care that they can while they are there. But for some reason, they seem to forget the oath that they swore to uphold. But anyway, we're gonna watch two news clips, kind of catch us up on what's going on at these stores, just in case you haven't seen it. And then I'm gonna give my take and my opinion on what we can do to get about this system or better uh, create situations to where we can have better survival and better treatment. Don't forget to like, share, comment, and subscribe. And when you do subscribe, hit the notification bell so every time I drop a video, you will be the first to know about it. Let's get into the first video.
Tonight, state leaders are addressing a viral video that appears to show a Black woman left waiting for a room while in labor at Dallas Regional Medical Center.
NBC5's Allie Spilliards spoke with one of the lawmakers calling for accountability. Allie, what did she tell you?
Brian.
Now, say she was waiting for a room, but we all saw the video. I know Parkland Hospital down here in Dallas. It's like a government hospital. They built a new hospital about 10 so years ago, I guess, maybe less than that. Yeah, around about 10 years ago, they built a new hospital and they dedicated a whole floor to labor and delivery because they know they needed. They needed that because they knew a lot of babies are being born, a lot of people on government, insurance and stuff, and or no insurance at all. But it's not going to stop these babies from being born. Matter of fact, I already said in the video before, most time people who have a lot of babies have no money. And those who are trying to make a lot of money don't have a lot of babies. So it just is only right that they build a hospital like Parkland or put a whole floor is dedicated to labor and delivery. But anyway, let's continue.
And Brittany, like many of her constituents, State Representative Retta Bauer says she wants answers about allegations that this mother-to-be was forced to wait more than half an hour while in labor. She and Representative Linda Garcia met with Mesquite City leaders and the CEO of Dallas Regional Medical Center this morning after they saw this now viral video. In a statement, the leaders expressed concern, pointing to CDC data that shows Black women are 3.5 times more likely than white women to die in childbirth. While the hospital is now conducting an internal investigation, tonight Bowers told me she believes this mother's race did play a role in her apparent wait for care.
I think it was evident that that's what was happening. And I think
you see that blur that nurse's face out. It's too late, y'all. We've already seen the woman. They got her name. They got a nurse number, her license number, and everything. This is, come on, y'all. It's, saying she's been filed or complaints have been filed by probably every Black woman in the state, and probably in the country. Yeah, y'all don't have to blur her face like that. It's too late. We already know what she looked like.
I have to share with you, Allie, that is what prompted me to move swiftly. Because the nature of what you could see in that video, it brought thoughts to me of my own experience in the community with an OB and gynecologist in the city that certainly worked out of that hospital. And I thought something has to be done. We need to talk.
In a statement, Dallas Regional Medical Center told us,
shout out to that sister for actually being a representative for her people and stepping up to help the community. Jasmine Crockett, I'm waiting to hear what she has to say.
The safety, dignity, and well-being of our patients are always our highest priorities.
Whatever.
We are committed to providing compassionate, high-quality care to every person who comes through our doors, and we are reviewing the situation to understand what occurred. Due to patient privacy laws, we cannot share further details at this time, but our focus remains on ensuring that every patient receives the attentive, respectful care they deserve.
Now you see this lawyer written statement talking about due to patient privacy laws. That's the reason why these laws are in place, not because they care about the patient. It's to protect them so they can say, well, hey, due to laws, there's nothing we can say. So we can't give you no more details. This and the third. This is for their own protection, not for the protection of the people that they are sworn that we, because I too am a nurse, that we are sworn to take care of.
Those involved have asked the community for patience as this investigation plays out, though Bowers tells me this really is just the start of the conversation. That woman's family, by the way, declined our interview request, saying that for now, they are focused on her recovery.
So I think the mother of that lady that was in labor, she put a video out on either TikTok, I believe it was TikTok, and she told the whole story. You can watch it. If I find it, I'll put the link in the description down below. But the thing about it is, like the representative said, she's had issues with OB, doctors in the past, and she had her own issues. I do recall having problems with the birth and the care of both of my daughters. My first daughter, I remember her mother was in labor. We ran to the hospital. Now, I think at the time I was working part-time at Walmart, so I don't think I had insurance. So I think her mother had, what's that, Medicaid. So, but we lived on the south side of town. The doctor that accepted the Medicaid was way on the north side of town, like a whole other side of Dallas. What I'm saying? It takes an hour to get from Dallas to Dallas if you've heard the joke. So, but this doctor we was in the south side of Dallas, and this doctor was like, not South Dallas. I don't want y'all to get it twisted. Actually, Oak Cliff. And we had to go to like Farmers Branch. For those who live in the area, And we get up there. Now she's in contraction like every few minutes. And we're trying to say, hey, she's having contraction, like the baby's coming. Oh no, the baby's not due yet. She's like, no, we think she is due because we haven't, she's having contractions like every few minutes. And so it was like she's been in the room for a long time. They gave us something to kind of slow the contractions down or what have you until a doctor got there, this and the third. Anyway, we sat there for hours. Doctor got there. He was acting like he didn't think that my daughter was coming. And showing up within a matter of a couple of hours, my baby pops out. My daughter pops out. But the way they treated her, treated us, treated the doctor, the way the doctor acted, he was like nonchalant, didn't believe it. Almost about to send us back home, I think. But no, eventually, like I said, my daughter was born. And then later on, with with my second daughter, I know, where was we at? What was happening with her? I know there was an issue. There was an issue with the pregnancy and that her mother needed some kind of medication, and the insurance didn't want to cover it, and because they were trying to say it had to be a life or death, situation. Well, then this time I'm working at a job with good insurance, full-time job where I can get good insurance. So at that time, back then we had HR people that worked actually in the building. So we had an HR lady who actually called the insurance, fought for us, pleaded our case, and the medication was finally uh, approved. And so she was able to take it. Then, my second daughter was born. But before that, kept having complications, losing babies, this, that, and third, like the little fetus or whatever. Because we couldn't get the medication. It took forever for it to happen. But the insurance didn't want to cover it. I want to say it was like life and death. I'm like, well, we're talking about a fetus that's alive. If she don't get it, the baby will die. So anyway, that that was the issues with that. And then I remember how the mom had some kind of other little female issues, and this same OB doctor from the beginning, the first one, he kept giving her pain medicine. That's it. Wrote off his pain medicine, but this would not fix it. So she actually got blessed enough to get a female OB doctor. And she said, oh, you having this issue. You need this, or you got to have this, or something like this procedure, what have you. And so then when we went back to her original OB, he was like, well, I guess you're going to sue us now, huh? You're going to file a lawsuit on us now, huh? It's like, dang, we ain't say nothing like that. But we can tell with his demeanor that he was either burnt out, uh, wasn't really feeling the government assistance insurance that he was taking, that he took. But yet now you mad because you got to take care of black folks that taking this government assistance insurance. So those, like I said, those are two issues that I remember back in the day that they just treated. Oh hell, I remember being, matter of fact, another story when before my first, my oldest was born. I remember my mother we got into like a little small fender bender. She got all upset, started contracting pains. We went to the hospital just so they can check her out. This is like Super Bowl Sunday. Man, we sat in that dang on room in the back for probably an hour or two, couple hours, and nobody came back there. So I went up to the front and was like, we're gonna get discharged and updates. I'm like, oh, we thought you was already gone. You don't see what I'm saying? So it's like this is nothing new. They have treated us like less than human, like human chattel, like they like the when they brought the most of us over here or put most of us in bondage. And it's never changed. It doesn't matter if you got money, doesn't matter if you got good insurance. Because back then you had good insurance. There's like 6, 7 plans you can choose from, and they was all good and they was all gonna cover PPO. You can go anywhere and things are great. But as time went on, to me, insurance is the big problem. It's the biggest problem right now. Because if you don't cross your T's and dot your I's with these insurance companies now, they don't pay these hospitals or these doctors, and these doctors do not, these doctors will not see you or treat you if they got to go through all that red tape. Which is why I see some doctors are doing like private pay. We can go in and like pay a fee every month and you can get certain services, when you pay that fee, which I feel like a lot of people should go to. But anyway, let me real quick find this other video right quick. All right, one more video. All right, so okay, I'll find it. Here we go. We're gonna see this one video about the lady out there in Chicago, who pretty much went through the same problem with similar problem with the hospital. Let's hit it.
Relatives of the couple say while they are thrilled to welcome a happy, healthy baby, this is not the kind of experience they would want for any expectant mother. Breathing through her contractions, Mercedes Wells was wheeled out of Franciscan Health Crown Point Hospital Sunday. Her family says hospital staff had just discharged the mother of multiple children, telling her to go home and wait for her labor to progress.
My daughter's in active labor, and this is Franciscan Crown Point being put out in active labor.
On Sunday morning, I woke up to frantic texts from my mother saying, call me as soon as you wake up.
Sharice Thompson says she knew her sister-in-law had been admitted to the Northwest Indiana hospital, but didn't expect what she would hear next.
But my mother was screaming like, your brother just delivered his baby. Your brother just delivered the baby. And I'm like, what are you talking about?
After the Crown Point Hospital discharged Mercedes, Sharice says her brother Leon escorted his wife back to the truck to find another hospital. 8 minutes into their drive, Leon and Mercedes' daughter was born on the side of the road, delivered by her father.
He grabbed like a blanket and then put the baby on Mercedes' chest.
Well, you're talking 8 minutes after you left the hospital. The story is that this woman was having contractions like as often as 1 minute apart. And they told her to wait. I don't care what the hell talking about. Told her to. That is diabolical, to say the least.
My niece on her chest, yeah. And drove the rest of the way to the hospital, to Munster Community.
Doctors at Munster Community Hospital took over, providing the care Sharice says Mercedes pleaded for in Crown Point.
Mercedes begged her. She begged her. And she said, no, I'm really in active labor. I can feel it. My contractions as I walk. I mean, my pain, I'm telling you, I can feel it. And she just ignored her.
The family now calling for accountability.
I want there to be some sort of change so that other families don't have to experience this.
If it implements change, it implements strength, and it implements courage in other women that's going through this, then that's what I'm looking for personally.
Franciscan Health Crown Point Hospital saying in part in a statement, the video and comments it has generated are deeply troubling, and we understand the concern this has raised. The video is just one part of the information we are reviewing as part of a thorough investigation into this alleged incident. The parents, together with their attorney, are planning to hold a news conference tomorrow morning to talk about how they plan to pursue justice. As for the couple's newborn baby, Cherise says mom and the baby are doing well and that she has a couple heroes for parents.
So you saw that statement again, that lawyer created statement. Man, let me tell you something. Here's what I know. As a nurse, it doesn't matter. Let me tell you something. I work in a dialysis clinic, but we are located, near the one. They're always near a hospital. Okay. Sometimes people get dropped off where I work. They get dropped off at the wrong place, wrong dialysis clinic, wrong side of the hospital, whatever the case may be. We don't just sit there and leave these people out in the lobby or leave them out on the street and say, "Oh, you're in the wrong place. You better find where you at." We do everything. Hell, I'd have had to take a person in a wheelchair and wheel them to the hospital, to somewhere to a certain area of the hospital they needed to go to. Going on my lunch break, saw them, asked them what's going on, what they need, figured out. Spend half my lunch break figuring out where these people go. I know there was somebody who was dropped off at our clinic also, to where one of our employees had to make a bunch of phone calls to figure out where this person was supposed to be. You know what I'm saying? Could have easily just, turn them around, push them outside the door, close the door, call the police, whatever the case may be. But that's not what you're supposed to do in the healthcare field. But for some reason, there are people who forgot about that, or maybe they just never believed it in the first place. So here's my thing. What's the solution? I feel it's time to get away from government daddy on all counts. But somebody has to take the sacrifice or take the challenge. Because as long as we keep running back to these places, because we see, like the one story said, there's Black women are 3 times more likely to have deaths. I think it's like 50 deaths per 1,000 births, per 1,000 people, women that have died during a birth for Black women. I think white women is like 24, Hispanic is like 14, and Asian is like 10. But for some reason, we still, and that's just deaths. We're not talking about, these 2 women didn't die. They just went through hell. So you can imagine what maybe the statistics are of just that alone. But see, back in the day, we didn't have those stats. We really didn't know. You know what I'm saying? But now with with AI and Google, you can go online, you can type stuff in and get all the information that you want on stuff like this to figure out what's a good hospital, where's a good place to get proper care. But what I say need to do is say, especially with childbirth, is the heck with these hospitals. Now I understand you got to go see, doctors to might need prenatal care, but grandmothers, great grandmothers, what I'm saying? A lot of them they ain't have nowhere to go for prenatal care. They can go no hospital, no doctor's office for a lot of times. Well, let's say if you can find a Black doctor just do prenatal care or what have you. But for the whole and for the process of having that child, I don't know how it all works out completely, but I say that Black women should really start back looking into getting a doula, finding a doula to help you have that child naturally. Because let's be honest, laying on your back having a baby is not natural. That's scientifically proven. They say women should have babies squatting like they got to pee or take a dump. That's the most natural way of doing it. And I mean, if it's the most natural, most healthy way of doing it, why not do that? But the problem is those doulas, they come under a lot of scrutiny with the government. They try to do things to shut them down, try to do things to fine them, try to do things to make it hard for them to do their job. But what's crazy is that's how a lot of our ancestors were born. Shoot, I know a lot of y'all can talk to your grandmothers, or hey, you can probably talk to your mother, depending on how old you are, and they'll tell you that there used to be a woman, a midwife, used to come into the house, especially in the black community, and deliver these babies. Why? Because there was nowhere to go in the city, in the town for black people to go. My mom done told me about stuff like this. So this is nothing. Like I said, this is nothing new. Matter of fact, hey, your grandma just probably just get done washing clothes and cooking peas, turn around, deliver a baby, and come back in the house and keep cooking like it ain't nothing. This is how it was. And sometimes you got to go back to basics in order to make things better. We done got too lazy, too complacent, relying on these places that's all for profit. Like I say, if your insurance ain't good, if you ain't got the money, they ain't trying to see you. And if you especially don't have a complexion for protection, they really don't want to see you. These women, the least that should have happened with both of these women in the stress that they were in, they should have found a bed for them somewhere in the hospital. It does not matter. Kicking them out or sitting there having her do paperwork while she's like this woman here is climbing on a chair, saying the baby is in her butt. And this woman is still trying to get the paperwork done. You could have done that while she's laying in bed about to have a baby. I say like this, even in dialysis, we have this packet that new patients have to fill out. Now, if they come in and let's say everything is not ready, they come in and we're not ready for it. It's been times where patient where I'm thinking we finna get ready to go. You know what I'm saying? All the patients are on the machine. Now we're just gonna shut the clinic, shut the doors down, and just wait till the last patient get done. And I walk out there in the lobby, and somebody sitting in the lobby saying, "Hey, I'm starting dialysis today." We're like, "What the hell?" So then I'm calling supervisors and doctors, and they're like, "Oh yeah, we forgot somebody is supposed to start today." So now we're like screwed. So now we're trying to hurry up and get the patient on. So the least we can do is have them sign a consent. One piece of paper. That's it. Sign a consent, say that you agree to do dialysis here, and we'll get all and then we get your ID, and then we'll do all other paperwork later on while you're on the machine, and we can do it tomorrow. We do it once you get out. But that's it. If you had to have something signed, that's the one thing you need to sign, consent. That's it. Understood. Sign consent, give your ID, put that one on the bed somewhere so she can go ahead and have this baby and get it and call the code, whatever you got to call, code baby, so they can have this baby. The woman was 1 minute having contractions every minute, and they told her she had to go to another hospital. Are you serious? Like, why would you do that? But a lot of times with these hospitals and doctors, they look at your insurance card, which is sad, and they say, "Well, we don't take your insurance, so we can't treat you." And they'll say that mess with a straight face. And heck, we don't treat the people in dialysis that have no insurance, but what they need is life and death. So we'll figure it out. In the meantime, in between time, we'll treat them, and hopefully they'll get insurance soon. But yeah, like I said, man, find like I say, a doula. They're everywhere. They're all over. You know what I'm saying? Right now is the time that them son guns should be promoted. If you know one, should be posted on Facebook, Instagram, YouTube, whatever the case may be. But you need to get the word out because this is ridiculous. It's only going to get worse. It's not going to get better because here's the thing: you're going to see stories like this. Everybody's going to be in an uproar, but you know what? They're going to go right back to the hospital to have a baby tomorrow, or they're going to get pregnant and they're going to be all right and going to try to sign up for somewhere to have a baby. When it's like, nah, we need to stop that. As long as you do that, stories like this will just go away and still gonna have these problems. We're still gonna have these issues that will not go away at all. But yeah, we got to get out this system, get back to nature, get back to each other, taking care of each other because we all we got. But with that being said, tell me what you think about this story. Leave your comments below. Share it with the world. Let's have an intelligent conversation. You know how we do around here. Don't forget to like, share, comment, and subscribe. Those 4 things cost you maybe a couple of minutes out your day. but it means the world to us here at this channel. And with that being said, I leave you in peace and love, and I'll see you on the other side.